Hello, my name is Miranda Henry, and this is my informative speech for PVCC's Online Communication 100s class. Throughout my speech, I will cover a brief overview of the background of mental health counseling, explain the communication skills needed to be an effective mental health counselor, and lastly, explain a few of their professional roles as well. I actually got into this career pathway when both of my parents passed away within a year from each other. It was definitely a very dark time in my life where I felt very alone. My caseworker actually recommended that I reach out to a mental health counselor myself. I started attending his sessions 1 to 2 times a week. The counselor that I was seeing lacked quite a few of the professional roles that I felt may have benefited me more as the patient. That essentially made me want to go to college, major in psychology, and start to learn more about our mental health. A mental health counselor is typically what people think of when they hear the word counselor. However, they specifically deal with people who have normal and abnormal cognitive processes, help deal and cope with difficult life events, and also help manage illnesses that patients may have. The Bureau of Labor Statistics has predicted that jobs for mental health counselors will increase by 36% between the 2010 and 2020 decade due to the need for more licensed counselors. The first point that I will cover within my speech is the use of positive and moving communication that mental health counselors must use with their patients. Using this type of communication skill is definitely one of the necessities for this job. Shelley Field, author of article titled Mental Health Counselors, stated, "It is the responsibility of the mental health counselors to help their patients learn how to cope with their situations in a positive and upbeat manner." Patients that may come into a counselor's office are more often than not suicidal, emotionally unstable, or in a bad state of mind and need a professional role who will help them work through these thoughts and emotions and eventually turn it into something more positive and upbeat. I think this is definitely one of the main focuses that this profession works towards. Another communication skill needed for this career is to enjoy to communicate. This is one of the most important skills needed because a good portion of this job is communicating with not only your patients, but with other healthcare providers and emergency services if needed. Because there is so much communication that occurs on a daily basis, you have to not mind enjoying to communicate with others as well as teaching, giving advice, helping, and being of service to others when they need it. Tying on to the communication skills, some professional roles that are used within mental health counseling are to be able to be someone's emergency point of contact and to be able to perform crisis interventions and use obtained communication skills to persuade and possibly soothe patients that could be in a very bad situation. The role of being a mental health counselor also requires you to be emotionally stable and be able to use your knowledge to stabilize your patients as well. There are different types of patients and different ways of communicating. I think another very important role of this career is to be able to manipulate the way you communicate to a specific patient that will benefit them in the long run. The presentational aids that I've included are both handouts that were given to me by my counselor when I was attending mental health counseling. The first one here goes over a few rules that I feel must be applied not only to patients but to the job in general. And this one goes over the skills being patient, empathetic, supportive, compassionate, and being able to be an excellent listener, all of which are required to be used on a daily basis for this type of work. My other presentational aid that I've included was an additional handout that was given to me by my mental health counselor that I felt was extremely relevant to this specific assignment and goes over the tips for effective communication. Three of them that I thought I would point out specifically are to be able to empathize, be humble, and use active listening. Under the empathize, it says to be able to put yourself in another person's situation, imagine how they feel, and show that you respect their feelings and points of views. I definitely think that this is a very important skill that is used when listening to your patients during your discussions, to always respect what they say and their opinions. Another skill tying on to that is to be able to actively listen to your patients. Demonstrate that you're listening by nodding, making eye contact, and confirming that you know what they're saying. And then lastly, here, to be able to be humble. Under the bubble here, it says, see yourself as you really are with both strengths and weaknesses, and don't talk to people as if you think you're better than them. I definitely think that this is an additional skill that's used on a daily basis, not only applying to your patients to help them learn how to be humble and to both recognize their strengths and weaknesses. Today, I discussed with you a brief introduction to mental health counseling, the communication skills needed in this mental health field, and also a few examples of their everyday roles.